Hello and welcome to Healthy Talks. I'm your host Julie, and today we are with Nursing Times Midwife of the Year, Wahida. Hi Wahida, welcome to Healthy Talks. How are you doing?
Hi, thank you for inviting me first. Lovely to be here. And yes, I'm quite excited to be here.
So are we, and I'm very excited for the audience to hear what you have to say about your experience. So, first of all, again, just congratulations on being awarded for as Midwife of the Year. What does this honor mean to you personally and professionally?
For personally, I think for me, it's setting the goalposts for South Asian communities and Black and South Asian communities because um, having that brown face rather than a white face
Mhm.
on the stage, it's just very, very significant. And what it meant was every person who came to me who was non-white said, "You've done it for us. You've done us proud." And I think that really that made so much kind of like it was quite emotional that they kind of felt that that's how they felt and it's that says a lot, even though one sentence and they all wanted pictures with me. So at a personal level, I think it was really touching. And then at the professional level, I think it's made a big difference in that the value of using multilingual resources because
Mm.
everybody wants one now and everybody wants to kind of do the same, which is phenomenal because instead of regenerating more information, you can just kind of like just redevelop it with using
Yes.
existing resources and saving time and costs. So yeah, if that answers your question.
Yes, definitely. You mentioned in our previous conversation that you have a very strong passion for tackling inequalities in maternity care. Can you share a specific moment or experience that ignited this passion in you?
So I think it stems from when I had my own children because when I had my own children, I wasn't a midwife. And I remember one of the health professionals coming to me asking me if I wanted tea, but instead of speaking to me, they actually just give me signs saying tea. And I just
Mm.
said yes, but I didn't talk anymore. And then I think later on it was alluded that I could speak English, and she came back to me and said, "Why didn't you tell me that you could speak English?" So my response was that you assumed that I didn't speak English, so therefore I just went along with it. And I think from then I thought, this is me, I can speak English, and these are inequalities that I'm experiencing. What about the women who actually can't speak the language or
Mm.
don't understand the system? And that's just one of the examples.
Definitely. And your path to midwifery is quite interesting, especially considering the challenges you faced with your husband's illness. How did those experiences shape your approach to care and patient advocacy?
I think when my husband became ill, obviously I was in a different career profession, I was in education. And what happened was when we went to get his diagnosis, and I can remember it was a while ago, we was in a room of people and there was only two of us. And basically it just said, "Oh, you have got this condition," but they didn't say what type it was, that was it cancer or anything. And we kind of were left alone. And it was only later on when I started research, I realized it was a cancer. And I thought, well, I understand it. So I thought, oh well, my husband's going to die. I was we were quite sensible about it. And from then, it was like, if this is how I feel, our family feel, a lot of the communities feel as though if they've got cancer, they're going to die because they're not supported with it, and they don't feel they get enough information. And I think
Mm.
from then, it really kind of inspired me to kind of look at how we can make changes. We've got a long way to go. Don't get me wrong. We're
Yes.
only kind of scratching the surface, but it kind of really made it real to me, thinking, well, this is what I'm experiencing. So how many more people are there that, we can make a difference to? And I think it kind of like that kind of like made it more kind of I think for me it made it really personal, but yet
Yes.
wanted to make that difference in the community.
No, definitely. You also mentioned you developed a multilingual tool during the pandemic to assist non-English speaking patients. You spoke about what inspired you to create this tool, but what impact have you seen it have on patient care?
So, I mean, initially, what inspired me was looking at the tools that were already out
Mm.
there. And one of them, particular one, was my birth, my choices. And I thought I'll try it, see what it's like. And for me, who knows how to use the internet and is quite good with IT, and I found it really difficult to navigate around it. And I thought, well, this is me, and I've got quite a good experience with IT. I thought, how the people who've got the language difficulties and might not be really good with digital technology. So from that, I thought, right, I need to make something different. So I created my own, and actually, I'm getting really positive feedback from the women, the families, and
Yes.
also from health professionals, because they're saying it's just made their life a lot easier in terms of they've got a family who comes and a new patient, new pregnant person, they've got a booking to do, which is like a checklist, about the family history,
Mm.
medical history, and they can just give them a QR code or a link, which they can access via their smart device, and they can just go to their own category. Say if they wanted something in British Sign Language, they can see all that information in British Sign Language, or if they wanted it in Urdu or Somali, it's all there and it's all significant. I mean, some of the information is really, really hard to get hold of. So the cost implications are that you have to get your own kind of products, kind of resources translated. But it's good in the long term. It's making that difference with the communities, because it's saving time. B, it's giving that informed information,
Mm.
informed choice, and also it's making the midwives aware of that different cultural and spiritual needs.
Yes, definitely.
Yeah.
And you've discussed the importance of cultural sensitivity in healthcare. What specific strategies do you believe are essential for healthcare professionals to adopt when working with diverse communities?
Yeah, so ideally, I mean, the key strategies that I would include is using clear language, visual aids, they're really, really key. Provide like communication cards, and obviously you need interpreters, because interpreters can be a key in getting the right information. So creating your own resources and education materials that can align with the community cultural context and language. So like we've got the Padlets, or you can have brochures. Also, it's really important to educate your staff about culture and competency. So regular training, having a point of contact, if they're unsure how to approach a certain initiative or a certain condition, to, have a kind of a champion,
Mm.
cultural safety champion, on to say, and also having that respect for different cultures, culture, practice, and foster and encourage that open dialogue about the preferences and the diets and gender specific care needs. And the other main one is community partnerships. So collaborating with the local leaders, working in mosques or, temples, gurdwaras, synagogues, and all, because you want to build them, you want to build that access and develop that access and that
Yes.
engagement with these communities. And and then also you're looking at adapting your clinical practice, so having a more inclusive approach, ensuring that you're integrating safe cultural practices and adding it to their care plans. And especially when you've got a person who's at end of life, I mean, looking at their different practices, because all religious will practice differently. And so it's so important to be aware of that.
Definitely. That is very important. And in your experience, what are the most significant barriers for non-English speaking women who face accessing a maternity care, and how can healthcare systems better address these challenges?
So, I mean, I've already mentioned some of them
Mm.
just now. I mean, one of the key ones is language and cultural barriers, and communities having limited English
Yes.
proficiency, and also that cultural misunderstanding, and that can hinder effective communication, especially if you think the assumption is that because they're speaking English, they understand English, but they might not understand it. They might just understand it up to the point how basic understanding, but they might not have that deeper understanding. Also, I think the other thing is financial barriers. So if we're making these appointments, they might not be able to get to these appointments, because some of these families, there are like poor communities, poor diverse communities, so they might not. That might be costing them to get to a point, so they might not turn up. So ideally, if you can have a locality of services which is near to their
Yes.
home, or take the service to them. And the other one I see is discrimination and bias. So, which can lead to unequal kind of care, so unconscious bias in some of the communities and obviously the health professionals, and that can lead to misdiagnosis and inadequate treatment. And also comes with that is the compliancy. So if you're giving somebody a treatment, but you've not explained to them how often to take it, when to take it,
Yes.
they won't take it, and hence that can lead to not having adequate treatment. Also, low health literacy. So we use a lot of jargon, like medical terms, but ideally we need to avoid using these medical terms and make it really, really simple. The other one is mental health stigma, because I know we can have communities who've perinatal mental health or mental health, and there's quite a lot of stigma attached to it. And it's ensured that, we've got services that are accessible at their level and at their understanding. So having, key link workers who can support that, reduce that barrier. And also look at communities such as like sensory people who've got learning disabilities or elderly, homeless people, so we need to look at our policies, policy really need to be equitable around these and deliver that bias training and have community driven solutions.
No, that's definitely true. And like you also said in our previous discussion, like just giving them that, like helping those women and other patients, just making informed decisions about their care. So this is
Exactly.
a way to do it.
Yeah.
Enjoying this episode? Ever thought of starting your own podcast? Podup.com is your go-to. They've got everything you need to run a pro show, including 35 or more AI-powered tools for success. Sign up today for a free starter account and get 15% off with the code HealthETalks15. The code is HealthETalks15. Plus, check out podallies.com for a done-for-you podcasting experience, complete with website, social media, and editing. Start now and let's launch your podcast together.
You've conducted outreach work like the vaccination bus for underserved communities. What lessons have you learned from these experiences that can be applied to improving maternity services?
So I think with that, I mean, a lot of services around here, we are kind of trying to use that kind of approach. And so what they're doing in maternity is having maternity hubs, so it's central to where the population or the pregnant women live. So when it's centralised and it's nearer to them, that automatic increases your access. But what I took from that, having a bus going around offering immunisation, is that's increasing the outreach, and it can access, and it's increasing access to communities who might not be able to attend, and for whatever reason they've got either got the too many got young children, or the husband's working, they've not got transport. And I think that really reduces your health disparities. Also, even you can have pockets like using you can use, like, if you've got like outreach hubs, and also institutions which are specific to each community, use that for education session, as I did at a local mosque. I delivered lifesavers event, so for women who are at home with young babies, to know if something happens to their baby what to do. And that was really, really powerful, because these women were saying, well, we never get anything like that, and they were saying they need more sessions on different kind of areas of health. For example, HPV, cervical screening, and
Yes.
having the targeted program bridges the healthcare gaps for these marginalised groups, and you're being inclusive. And also it's preventative care, which is going to reduce your hospital visits. And also having that, talking about mental health, mental health is quite hidden under the carpet, but to talk about it, it does improve that it's actually okay to feel low and have a mental health condition, as long as that support is there. And also looking at, being culturally sensitive again, and strengthening patient-provider relationships. And this can overall improve your public health outcomes, saving, cost saving, and it actually contributes to a stronger and healthier community.
No, that's definitely true. And you've mentioned also before the need to integrate spirituality and cultural sensitivity into perinat- pe- prenatal mental health care. How do you envision a more holistic approach benefiting expecting mothers and families?
So with a holistic approach, it integrates spirituality and cultural sensitivity, and that's about, incorporating that into perinatal mental health, and that can benefit an expectant mum and families by providing and fostering that supportive environment that respects their belief, and also having this approach, so getting away from the total biomedical model, and kind of like working together with a spirituality approach and a cultural sensitive approach, looking at the cultural values, and that's going to reduce stigma and overall improve emotional well-being. And by honouring spiritual practices and cultural preferences, healthcare providers can help mothers feel seen and understood, and that strengthens their mental health support, and it will lead to better health outcomes for both mother and baby and the extended family.
That's true, that's right. And what steps do you think need to be taken at the policy level to reduce inequalities in maternity care, particularly for immigrant and marginalized communities?
So I think currently, I mean, we are starting to look at what services we offer and looking at, doing like questionnaires with the groups, doing bespoke focus group and asking what they need, what is their need, what do you think will improve their healthcare? Because this has never really been done before. And if it has, it's just been very, very kind of short snapshot and then nothing done with the information that we've got. So doing a gap analysis, looking at staffing levels, looking at what cultural competency training have they had, because ideally that should be mandatory. So every health professional, midwife, being a doctor, needs to have that cultural competency training. And also language service, looking at, your language service that you use, whether how equipped are they. I mean, rather than using phone interpreters, to use face to face, because that is better. And then for women, especially if they're having baby, using the same sex as them, because if you're going to have a male person doing interpretation, they're more likely going to be from the same culture, and that kind of can be a bit embarrassing for the families. So I think that's really, really key. And also having a community partnership, which, and then again, it's about outreach work and looking at your data collection and tracking your demographics. And by tracking your demographics, you can identify and address disparities. And ideally, these steps would promote equitable, accessible, and culturally respectful maternity care.
Definitely. And for my last question for you today, Wahida, I've learned a lot about your field and your passion, and I hope that as the time comes that everything just gets a bit better. But as a leader in your field, what advice would you give to aspiring midwives or healthcare professionals who want to make a difference in addressing health inequalities?
So what I would say is commit to lifelong learning. That's really important, because it's the healthcare field is forever changing. So continuously educate yourself about different cultures, competencies, social determinants of health, and specific needs of diverse communities. Engage with communities, because sometimes that doesn't happen. We need to build a strong relationship with the communities they serve. Listen to the experiences, especially the lived experiences, and understanding the unique challenges, and involve them in the care process. And one of the other things is advocate for policy change and get involved with advocacy efforts. What I'm finding is a lot of the communities here at the hospitals, they've got PALS, which is, it's like a complaint service. So in the information, it's all in English, and the service users, they're not told about PALS, or especially if they speak in a different language, because everything's in English, it kind of gets missed. And you might say to them, oh, you can, if you're unhappy with this service, you can contact PALS, but they won't know what it means, and they'll just say, well, we're happy because we get better care than we did when we were back home. But actually, we need to get out of that, because the care here, it doesn't need to be good, it needs to be exceptional. And obviously we need to use that voice to highlight the needs of these marginalised groups. We also need to be empathetic and respectful and approach every patient with compassion and recognizing their backgrounds and experiences. And again, respecting culture, practices, and beliefs, and using a holistic approach, not just physical health, but also mental, emotional, and social well-being, and incorporating spiritual and cultural sensitivity in the care that you plan. So if you're having a personal care plan, ask them what the religions are, ask them what kind of the cultural practices, and embed that into the care plan if it's safe to do so, if it's within the proper guidelines. And also challenging the policies and guidelines, because what I've found is some of the policies, you look at it and it talks about all this information, but it's not looked at different cultures, how different cultures or religions would see that. So really, it's not, you've just lost, it's not
Yes, yeah.
equitable, you know. And also promoting health literacy. So going around, so where we have friends and family test, it's all in English. And what I've tried to do is get them developed in different languages, but because you can't really translate that, it's really difficult. Just put like smiley pictures on, and from that, you know, if they tick a yes to a smiley face, that means that they're really, really happy. And it's just doing putting simple measures like that, and also creating resources for each ward area. So what I'm doing at one of our trusts is creating for each, so if they're on an antenatal ward, creating resources which are specific to a treatment. So if it's for induction of labour, having translated resources for induction of labours and using picture so they can understand if they're in pain, you know, that they can have pain relief, if they're bleeding, you know, to inform someone. So simple measures like that go a long way.
Definitely. Like I said, simple measures, just going that little bit of extra that makes a huge impact on someone else's life and in healthcare as a whole.
Definitely, definitely.
Well, Wahida, thank you so much for joining us today. I really do hope that everyone who's listening really takes in what you said and just goes that beyond the extra and beyond and just do the simplest things to make a better improvement for everyone.
Oh, brilliant. Thank you for having me.
It was only a pleasure. And to all our subscribers out there, remember to like and subscribe, and we'll see you in the next episode of Healthy Talks.